1 minute to 8 it is on the AM show. Time now for us to talk. Yesterday, President John Dramani Mahama said a few things that's been trending from later in the evening yesterday, and I guess the whole day today. We're going to have a piece on that particular subject, the subject of strikes in general, and then we'll get on to other matters. But my guest seated now. Just quickly introduce them to you, and then we'll get this discussion underway. But if you've had anything that you also want to have your say on, just go to facebook.com/Joy News on TV. I see a lot of you commenting on the strike issue, and I'm going to be reading some of the messages as we go along. But my guest, Fred Amankwa-Safo, is a member of the NPP communications team, also a member of the NDC's Alhaji Halidu Haruna. So good morning to you, gentlemen.
Good morning.
Okay. I'm sure that you've heard what President John Dramani Mahama had to say about the strikes, but let me just read a portion of what I have, which is in relation to what he said yesterday. You remember what when he related himself to the dead goat syndrome? Some people thought that his comment had brought back that comment that he made when he visited Botswana. Now, reiterating his commitment during the 80th anniversary celebration of the Ghana Registered Midwives Association here in Accra, President Mahama emphasized that he will not authorize the payment of salaries and allowances that has not been captured in the budgets. And this is quote: "Just yesterday, a friend was urging me to intervene and accede to the demand of the doctors. After all, there are only 2,800 of them." He failed to realize, and President Mahama said this, he said a friend, told him, why don't you just give in? After all, they're just 2,800. And the president said that what his friend failed to realize was that there are some 590,000 other public sector workers organized in 11 other professional groups lined up and just waiting to see what the doctors come away with from the negotiating table before they put in their demands. This will adversely affect the single spine pay policy and could result in breaking the spine. Isn't this fact, Mr. Amankwa-Safo? This is it. I mean, he said it straight to the point. And some people have said he's been decisive. This is what we want in a leader.
Right. Thank you very much, and good morning to our viewers. It is not. My first point is that if somebody talks to you in confidence, you don't go out there parroting what you have discussed with your friend. Lobbying is part of democracy. In the democratic world, people will lobby. People will find other means of getting what they want. And president, leader of a country, a friend had come to confide in you, trying to lobby you, and you go out there parroting what discussions you had with your friend. I think it's really, really takes trust out of the president, meaning that if anybody comes to him, he would go out there to tell the world. We have been told severally until recently that the economy was doing so well. The economy was doing so well. So what are we talking about now? And he's talking about the fact that it is unbudgeted. Really? What were the projections for interest rates for the year? What was the projection? What was the projection for exchange rates? What were the projections for fuel? Is it budgeted? Are these indicators budgeted for the year?
Clearly, salaries would be budgeted because you know what you're paying at any point in time.
Why are you paying? Why are people being paid? Livelihood. You pay your employees so that they can live. That is why you're paying them. So, and negotiations are part and parcel of industry. So, if you are the employer and you know that negotiations are sacrosanct, it means that you can't take it away from somebody. Everyone has a right to negotiate on his conditions of service. And he's doing it with you. You are on the negotiation table. You have not ended your negotiations. And then you go out there and say you won't do it. Then there's no point to negotiate. And people will take entrenched positions. At the end of the day, the economy suffers. The people of Ghana suffer. We are governing not by ourselves, not by our whims and caprices. We are governing because we want the betterment of the people of this country. This is the height of arrogance. And I'm surprised
The
that
comments by the president?
yes, it's the height of arrogance. You are negotiating with somebody, you're on the negotiating table, and you go out there to tell the world that you will not budge to anything. What's the point to negotiate then?
I mean, is it wrong for him to say that
don't even,
I'm not going to go beyond my budget?
you see, the contradiction and the paradox is that, one, in the same breath, the president is telling us that negotiations are sacrosanct. In the same breath, in the same statement. And he's failed to realize that though negotiations are sacrosanct, he's giving no room for anybody to negotiate. That is what he's telling us. And I find it really, really surprising that President Mahama will go to this extent. Even if that is what the government stance, the position is. I'm sure that the way you communicate your will to those you are negotiating with.
So you think he didn't communicate well, yes?
I think he missed the point entirely. One, he shouldn't come out parroting the discussions he's had in private with his friend. Okay? And then two, he does not have to tell us that he's not going to pay anything out of budget.
Even if it is the truth?
Even if it's that, you don't do that in public, then what's the point in negotiating?
Okay.
I would have thought that a communicator as he is would be a bit more circumspect, because these issues that we have now in the labor front, especially with the doctors and the teachers. Today, look at the number of unions that are lining up to say they are going on strike. What happens? So let's find a better way of addressing our issues than being arrogant and throwing everything to the dogs. I think it's rather unfortunate for the president to say that.
Alhaji, some people think that, you see, this is evidence of the dead goat syndrome is working.
Thank you very much, Mahavi. Let me say good morning to our cherished viewers. Indeed, it's important for us to appreciate that we are building a country. And in building a country, you don't consider the interest of few group of people at the expense of the larger group of people. Just as His Excellency the President indicated, 2,800 doctors as against over 590 professional groups who are waiting to see what will come out of this particular negotiation with the doctors. His Excellency the President, when it comes to communication, I'm sure my colleague will confirm that when it comes to communication, is an expert in communication. And the point is that...
Does it mean he can get it wrong sometimes?
Well, he's human. And as a human being, certainly you would. But on this call, I would disagree with anybody who would want to tell me that he got this wrong. I would disagree. You see, the same people accused this government in 2004 for spending over the budget. Didn't you hear that accusation?
But even in 2015.
But I'm asking you, didn't you hear that accusation?
But even in 2015.
Yes, but at least
you're overspending.
You are confirming that you've heard the accusation made by my colleagues, isn't it? Even in Parliament, they propose that we should have appropriation bill, we should punish those when you go beyond it, etc. And the president now is heeding to their own advice. Don't spend beyond your budget. And he's saying what? Isn't it hypocrisy? Is it the principal positions that they were actually advocating at that time? If it is a principal position, they should commend the president for giving the assurance to the people of this country that this time around, I won't go beyond my budget.
But is conditions of service necessarily going beyond? I mean, conditions of service is something that should come to me anyway.
Conditions of service, yes, that is why
at all times budget for it.
He is only reminding the medical fraternity that, look, we have a budget. We have budgeted to spend within a certain regime. We can't go beyond it. And therefore, when you are negotiating, bear in mind what we have within the budget.
Was that the right platform? Because government already has a lead negotiator in all these. Remember the Fair Wages and Salaries Commission.
Public service.
So why don't you pass the information through and let them say it on the table? Why do you say it to the whole world?
This is public service. The president was elected in 2012 to serve the people of this country. and to serve their interest. The medical doctors are also serving the public. If the medical doctors are taking a certain positions, and government is also taking a certain position, the only way out is the people of this country who voted for him to get to know what is it about that is creating the disagreement. Is it out of place to tell the people who voted for him that, look, this is the issue, and these are what the doctors are demanding? These are the reasons why we cannot afford to do what they are demanding for. Is it wrong? If indeed the doctors, what they are demanding, it is within an acceptable limit, they shouldn't be offended for the public to know that, yes, this is what we are making the demand for.
And so, you know, some people have also said that this goes to endorse, really, what a member of the communication team did by publishing or making public details of what the doctors had presented on the negotiating table, which was supposed to go out. I don't know.
I don't know about that. And indeed, the statement issued by government through the minister in charge of employment never quoted any figures. Did he? He never quoted.
Are you failing to also realize that Standowe puts details of,
I don't know about
things
that.
on his Facebook page, which was widely read?
I don't know about that.
You haven't heard about it?
Standowe is a citizen of Ghana. And indeed, sometimes we make mistakes. The fact that somebody is or associate himself with government does not necessarily mean that whatever he does is a reflection of what government believes in. It does not necessarily mean that.
But nobody has come out to condemn his actions. I mean, he works in the presidency. If he got hold of such details and he decided to make it public, that is important.
Am I not a Ghanaian with the right to discuss national issues?
You are a Ghanaian in a privileged position. I think at all times you should recognize that.
But the point I'm making is that the demand being made by the medical doctors, they deem it fit and appropriate to make those demands, isn't it? They are making demands because they serve the people of this country, isn't it? And we are telling the people of this country, these are the things they are demanding.
Really?
Is it wrong?
Really?
I'm asking, yes, is it wrong? The people are serving people of Ghana. And then the people of Ghana are being punished because of certain demand that they are not getting. Are they not being punished? Today, when you fall sick and you go to the hospital, you won't get that.
So why don't you leave it to the people negotiating to come up with it?
The people negotiating.
Because in the end, when they are done, if they want to share the details with us, they will.
The people negotiating certainly will do their work. But the people of Ghana deserve to know what is it that is creating the disagreement.
Let's go forward with this.
It is not out of place.
Let's go forward with this.
Let me make this point. I beg you permit me. I'm surprised. He seems to create an impression that the pronouncement of His Excellency the President smacks of arrogance. Excuse me. Have you forgotten when NAGRAT declared a strike, of which your government refused to pay their October salary? They were having their press conference. President Kufuor moved in there unannounced, sat on the high table, and told them that, look, go back to your classrooms, and that people taught you before you became what you are today, and making those demands. Go back. What do you describe that? Do you describe that arrogance? Was he actually doing it to protect the public interest? Please, let us be principled in our politics. You see, we are building a country. We cannot, for convenience sake, continue to be playing football with the public interest. Look, what the doctors are doing, I personally,
is it rhetorical?
Would you give him the opportunity to react to what you just said?
Is it rhetorical?
It's rhetorical.
But do you want to? If you want to, I'll give you.
When he gets his turn, he can do that. Now,
but you're landing in 30 seconds.
Of course. In principle, I have no difficulty because every worker deserves to know he or her condition of service. You cannot be employed without knowing what you are entitled for. But in making those demands, they must be mindful that what we have today as a policy of salary or payment is single spine. Single, it's not double. So if they mount so much pressure on the single spine, as the president indicated,
it's just a name.
We are likely going to have injured that system. And just as Pricewaterhouse salary structure, as a result of persistent demand by the same health sector, I worked under Ministry of Health from 1996 to 2001 when I left to go to school. And I'm telling you that I happened to be one of the officers who paid them on table their allowances which they were demanding. It was because of persistent demand by the health sector, which government heeded to, and it caused serious disparity that resulted in the MPP coming out to say, no, let's look at our wage bill again, and let's fashion out so that we close the gap in terms of disparities of our salary listing. So let us not do things
to
destroy. We have invested so much in that. Government remain committed in sitting with them on the round table. We will certainly give in, but not beyond our reach. We can't give what we don't have.
Okay.
I don't know about President Kufuor going to the high table and sitting in and telling the Labour that they should go back to their classroom. I don't remember. I don't know. I don't know. And he's talking about principle. I think charity should begin at home. At the presidency, over budget expenditure were very high. What has the president said? Of course, you should spend within your budget. Where does it start from? Why is the presidency not spending within its budget? Why are we paying so much money? Look at the amount of money. Was Azuntaba money budgeted for? The Suba money, was it budgeted for?
Now you're going to areas
you see, this is where the hypocrisy comes in. And my brother does not understand why the president is being arrogant. Look, you are telling Labour that you have the right to negotiate. On the same platform, you are telling Labour that you don't have the right to negotiate. Where is the right?
How?
Because he says that he is not going to do it. So if he's not going to do it, is it deceiving the...
Within our budget.
Is the president deceiving industry? Is he deceiving the doctors? That you come, let's pat your back, let's act as if we are negotiating with you. But in reality, we are doing nothing.
Well, the fact is, we don't know what is within budgets and what is not.
We don't know.
Nobody would directly give us that response.
So
we don't know if what the doctors are asking for would affect it or not.
Somebody has come out with what the doctors are asking for. Where is the government's response? Do we have the same person who brought this up? My brother is saying that he has not seen it. He's not seen the... But you have seen the figures, and I've seen the figures. This is negotiation. What is the meaning of that? It's not a trend position. It is not a demand on the purse. It's an asking price. And all you need to do is to say, okay, this is what I have, and these are the reasons. But if you, the president, come to tell us that you've given the chief negotiator, like you rightly said, to do that bidding for you, everybody has a role to play in this government. So the chief negotiator is the one who is talking to industry. He's talking to the doctors. So why do you take charge of it? You must as well take charge of everything that is going on in this country. And you have not made any statement to condemn the over expenditure that the government itself has done.
What do you think the effect of this speech would be? Because the fact still remains that negotiation is not ongoing. There was supposed to be a meeting yesterday, but no meeting was held.
I'm not a doctor, but I would have given up. I would have given up.
What do you mean? As in resign?
No, well, resignation is one point, but you cannot instruct them. You cannot advise them.
Is it fair that we're talking and then you decide to go on strike?
You know what? I'm a businessman, and I negotiate on a daily basis with my employees, with my clients, with my customers. Negotiation is a daily thing. It's a natural phenomenon in every setup of humans. In every establishment, in every organization, negotiations are normal. Even your salary, you could have the same qualification and experience. But the way you negotiate, the way you present yourself to your employees, your employers, would make you earn less or higher than what somebody else is doing. That is the negotiation. That is the power of negotiation.
Well, I've got this for you, Alhaji, because you said you didn't see Stan's posts. My directors want to show before we continue. So here we go. We just want to bring it back to you. Okay, it's very small. I'm not sure you can read it, but we can make a copy for you if you want.
You see, Mawavi, can I speak?
Yes, Alhaji, you can.
It is important to make the point that this government has even been magnanimous in respect of the demands of the doctors.
It's not only the doctors, so you know what's happening now. You know, UTAC has
No, we
also
are
declared
talking.
a
We are
strike
talking.
action
We are talking
because
about
we're
doctors.
boxing every
okay.
all
But
of it together.
in respect of the doctors, this government has been very magnanimous. Look, under the MPP, do you remember the
Do we
sack?
always have to do this?
No, but you see,
I mean, we're confronted with the situation
minute,
now.
Wait a minute.
Do we always have to refer back in the MPP?
We have to make the reference because without knowing the basis where we are coming from, it becomes difficult for us to know
we
where
are
we jump
here
from.
today.
We are here today.
The doctors are not politicians.
The MPP is the basis.
Did you listen to the General
politicians.
Secretary of the GMA? Did you listen to him? Did you listen to the tape?
Which of the conversations?
Siribo, did you listen to his tape?
The one that he was contributing on the radio program.
Is it a contribution?
No, but are you?
If I sit here,
but what are you saying
use those
to that?
vulgar words. Look, a medical doctor who is a member of parliament, I accompanied him to a program, and the people were insulting him. He stood quietly and was just listening to the people. After that, he apologized to them. So we left the gathering and I asked him, I said, the kind of words they are using, if not because of politics, it will be difficult for them even to see you on the street and approach you. But yet, you stood quietly, they rained insult on you, you never even responded, you eventually decided to apologize. Why? You know the response? That is why I am a medical doctor. Without patient, I will not be able to deal with my sick person. That was what he said. Now, you have a general secretary of the Ghana Medical Association who could not contain the opinion of a citizen of Ghana.
Isn't he human?
Isn't he human? Of an NDC communicator.
Isn't he angry because something that he is
100 doctors in this country were sacked some years back because of certain demands they were making. The government could not even tolerate them. Frimpong Boateng sacked them, 100, and asked them to go and then individually applied. Do you remember that?
I don't.
You don't? You don't remember Frimpong Boateng as chief executive of Kolebu?
You're telling us right now.
As chief executive of Kolebu. Oh, but as I said, I don't know about this, what is it? Standard-based thing.
So I showed it to you. Yes.
You produce it.
But you're telling...
You have the records of also chief executive. So provide the records.
But if I had, I would have shown it to you.
You should. How did it happen that you have Stan's own, but you cannot get chief executive from Boateng's own for me? It's important you present that. But the point I want to make here is that you see, we are building a country. And in all seriousness, may I support the idea that we should look at these issues of condition of service for the medical doctor. They are doing a human job. They are doing good in terms of saving lives. But you see, in doing that, bear in mind, I've listened to another medical doctor who is saying, look, our profession does not allow us to engage in what we are doing. Now, the doctor's actions presupposes that give us more money, else Ghanaians will die.
That's not
it
what
is not
said.
By their actions.
But you know, you are entitled to interpret it the way that you want.
That's what I'm saying. By their actions.
I want us to move forward. I think we spent a lot of time on this without even adding the teachers' strike to it. We've gone back to the same book and research allowance kind of business. It keeps coming back, and I don't know where we are going with this.
Oh yeah, that is what most people don't know. Most people don't know where we are going with labor, and. I'm sure Ghanaians are aware that the president, not even in Ghana, he said that far away in Botswana, that he has developed a deadwood goat syndrome.
It was in context.
Whatever. So, and I'm interpreting the context. That's, I mean, it's the same labor issue that he said we can go to hell.
Oh, so he didn't say that.
If you have a dead goat syndrome, what does it mean? It means whoever is complaining or asking for something can just forget it because you are not going to be affected by it. But in the same breath, he will overspend, do things that is outside of budgets, outside of parliamentary approval, and get away with it because he is the president. Yes, the people of Ghana must know now. The NHI that I pay and you pay on the purchase of every item in this country is not paid to the statutory accounts. The GET fund...
Maybe not on time, but they do.
So, not on time. Time is a very good factor. Time is of essence to everything that we do. Otherwise, the doctors will not be here. We've been here before. We've gone through this.
So how can we resolve this finally?
We can resolve it if the government stop playing the ostrich and stop doing the political comparison. I'm happy that the MPP is the basis for it. When we came up with the single spine salary, you spoke against it. In 2009, when President Mills came to power, he asked the Labour to give him time, 1 whole year to study it. Meanwhile, those who really thought through it and came up with a single spine salary structure were not invited to take part in any of the deliberations, right?
You know that for sure?
I know that for a fact. We've issued statements to that effect. So, if we do not know how to negotiate, let's have professional negotiators.
Oh, that's what you think?
Yes, let's do that. And let's decouple government from these negotiations. Even if it is your mandate, you can always have somebody to do so. That is why we have consultancy. Because it looks like the negotiating team of the government, either they don't have the mandate from the presidency, and now I'm beginning to think that they do not have. They've just been asked to go and represent something. Just let Ghanaians know that we are doing something. UTAG is coming up. Nurses are going on strike. And you think that Ghanaians shouldn't talk about it? Yes, the people of Ghana will suffer if the doctors don't go, if the teachers do not go. They will suffer. But the employees themselves, they will suffer more. The doctors also have parents. They have mothers. They have children. They have relatives. And I'm sure that nobody is an isolated person in this country. So the doctor or the nurse would have to depend on another profession for other causes.
Well,
we cannot continue to do this to ourselves. I'm happy that Alhaji is saying that let's find a good way of doing all these things.
So, I wanted to ask, what's the way forward?
That includes effective communication. Yes. Let's communicate with people with some finesse and some circumspection.
What's the way forward? Some people have said, let's all keep quiet. Let the people who are supposed to be doing the negotiation do it behind closed doors.
That cannot happen in a democratic environment. You cannot gag any individual. You can't do that. The Constitution of the Republic of Ghana, it is enshrined in the Constitution that freedom of expression is sacrosanct. You can't take it away.
So you
cannot tell me that a decision
leak details of discussions,
a decision that will be taken, which would either affect me negative or positive, you ask me to keep quiet over it. You can't tell me that. I will speak my mind if I deem it fit to speak my mind.
Who would lose in the end?
Who would lose?
In fact, who is losing right now?
Losing what? It rather enriches the discourse, because in the midst of the talking, who knows, somebody may raise a very vital idea or suggestion that could also even assist or help in the negotiation that we are in. But let me just correct some misinformation put out there. He said everything that you purchase, you pay National Health Insurance levy. That is not correct. He should go and check. Not everything.
Okay, let's move on.